Hi, and welcome once again to Dr. Vanessa Giraldo's channel. Today's video is all about the hyaluronic acid treatment. What is hyaluronic acid? Hyaluronic acid is a natural substance produced by our body, found mainly in our skin and joints. It acts like a sponge that retains moisture, making the skin look fresh and healthy, and can absorb and retain up to 1,000 times its own weight in water. This incredible capability is what keeps our skin hydrated and flexible. When we are young, our skin is full of hyaluronic acid that gives it that smooth and luminous appearance, providing volume and structure. However, with age, our body produces less and less hyaluronic acid. From ages 25 to 30, this production begins to gradually decrease. The visible results are wrinkles, more pronounced creases, and loss of volume that makes the face look less defined. By injecting hyaluronic acid, we physically fill areas where volume has been lost and restore the ability of that area to maintain hydration. The result is a fresher and more rested face, with volumes restored naturally, always respecting your unique features and facial expressiveness. Is it safe to inject hyaluronic acid? Hyaluronic acid is considered one of the safest aesthetic treatments available today. It's something your body already knows and naturally accepts. It's important to note that hyaluronic acid is completely different from biopolymers. While hyaluronic acid is a natural substance present in our body, biocompatible and biodegradable, biopolymers are synthetic substances that can cause serious long-term complications and are not approved for aesthetic use. One of the great advantages that reassures patients is that the results are completely reversible. A special enzyme called hyaluronidase can be applied to dissolve hyaluronic acid quickly and safely, something very few aesthetic treatments can offer. Side effects are generally minimal and temporary. There may be slight swelling, small bruises, or redness in the injected area that disappear within a few days. Additionally, at Dr. Vanessa Giraldo's practice, only hyaluronic acid products from recognized brands approved by the FDA in the United States are used, with extensive scientific research supporting their safety and efficacy, such as Restylane and Juvederm. What types of hyaluronic acid exist? Hyaluronic acid is not a single product, but exists in different varieties, each designed with a specific purpose, allowing Dr. Vanessa Giraldo to provide personalized results for each face. Hyaluronic acid varies in its consistency and stability, which allows us to adapt it to each facial area and the desired effect. Low-density hyaluronic acids have a soft and fluid texture, perfect for treating delicate areas such as eye contour, attenuates dark circles, and softens expression lines without creating excessive volume. Lips provides hydration and natural definition, improving their appearance without exaggerating their size. Fine lines on the forehead decreases the depth of wrinkles and is an excellent complement to Botox in that area. Barcode lines around the lips softens perioral wrinkles with natural results. Neck improves hydration and attenuates horizontal lines. Décolleté improves signs of aging and dehydration in this sun-exposed area. Hands rejuvenates their appearance by giving volume and decreasing the visibility of veins and tendons. Ears restores volume and firmness in lobes that have lost elasticity. Acne or atrophic scars helps fill scars that have generated fibrosis in the skin. Medium-density hyaluronic acids are our great allies for areas that require more structure while maintaining flexibility. They are ideal for nasolabial folds, those lines that frame the smile from the nose to the corners of the lips. Cheeks. They provide moderate volume and recover deep hydration. Marionette lines. These are the wrinkles that appear from the corners of the lips to the chin and give the face a sad appearance. Definition of the lip contour, providing structure without exaggerating volume. When we need more projection and structure, we turn to high-density hyaluronic acids. These products, with a higher degree of cross-linking, have the ability to create volume and lasting definition in temples or temporal region, provides projection and recovers the structure of the face, which tends to become more hollow with age. Jawline creates a more defined line that improves facial contour and provides a more stylized appearance by marking the mandibular border. Chin improves proportions and achieves feminization or masculinization of the face, balancing the facial profile. What should I do before the procedure? Preparing properly for your hyaluronic acid treatment is as important as the procedure itself. Dr. Vanessa Giraldo recommends following some simple guidelines that will help maximize results and minimize any possible side effects. 1 week before your appointment, it's advisable to avoid certain medications that can increase the risk of bruising. These include aspirin, anti-inflammatories like ibuprofen, and natural supplements like ginkgo biloba, garlic, or vitamin E. If you take any medication prescribed by another doctor, don't stop it without consulting first. During your initial evaluation, Dr. Giraldo will analyze your particular case. It's also advisable to reduce alcohol consumption the day before the procedure. Alcohol dilates blood vessels and can increase both inflammation and the possibility of bruising. To ensure you feel comfortable and avoid dizziness, we recommend eating your normal portion before your appointment to keep your blood sugar levels stable and avoid any discomfort. On the day of the procedure, come with a clean face with little or no makeup. This not only facilitates the evaluation of your skin, but also ensures a more hygienic environment for the application. If possible, schedule your session on a day when you don't have important social or work commitments immediately afterward to give yourself time to rest. If you experience any active skin infection, fever, or herpes outbreak on the scheduled date, it's better to reschedule your appointment. Your safety is our priority, and these temporary factors could increase the risk of complications. How is the procedure? Upon arrival, Dr. Giraldo will perform a detailed evaluation of your face, analyzing your expressions when speaking and smiling. This dynamic analysis is fundamental to achieving results that respect the naturalness of your facial movements. Photos of your face will be taken in different expressions and movements before the procedure, which will allow Dr. Giraldo to precisely evaluate the results obtained and establish a record of your evolution. It's not just about filling wrinkles, but understanding the unique anatomy of your face. Before starting, an anesthetic cream will be applied to the areas to be treated. This cream reduces any discomfort during the procedure. Additionally, the Restylane and Juvederm products we use already contain lidocaine in their formulation, which provides an additional anesthetic effect. Dr. Giraldo will explain each step as she performs it, so you know exactly what is happening at all times. Using advanced techniques and her expert understanding of facial anatomy, injections are applied precisely at strategic points previously identified. It's important to note that the amount of product used will vary depending on your individual goals, your unique facial anatomy, and the expected response to treatment. All these details will be explained to you in detail during your consultation with Dr. Vanessa Giraldo, as it is necessary to sign an informed consent before the procedure, where these personalized aspects of your treatment will be specified. The injection technique varies according to the area to be treated. In some areas, blunt-tipped cannulas are used instead of conventional needles, which significantly reduces the risk of bruising and allows for a more uniform distribution of the product. During the procedure, Dr. Giraldo will mold and shape the hyaluronic acid with gentle massages to ensure a natural and harmonious distribution. The complete procedure generally lasts between 25 and 30 minutes, depending on the areas to be treated. Immediately afterward, you can see the results, although the final effect will be appreciated a few days later, when any possible mild inflammation decreases. At the end, Dr. Giraldo will offer you a mirror so you can appreciate the changes and will give you detailed instructions on aftercare. What should I do after the procedure? During the first hours after the procedure, it's normal to experience a slight sensation of swelling or redness in the treated areas. You'll also notice a sensation of numbness due to the effect of the anesthesia, which generally lasts approximately 1 to 3 hours. This sensation is completely normal and will gradually disappear. These effects are temporary and are part of the natural adaptation process of your skin. To help reduce them, you can apply cold compresses gently to the area for 10 minutes, several times during the first day. Cold not only decreases inflammation, but also helps prevent possible bruising. During the first 24 hours, it's better to postpone the application of makeup. Although if necessary, after 12 hours, you can use non-comedogenic products applied with clean brushes. In the first 48 hours, we recommend avoiding activities that significantly increase body temperature, such as intense exercise, saunas, steam baths, or prolonged sun exposure. Heat can enhance inflammation and affect the distribution of the product. Hydration is fundamental to enhance the effects of hyaluronic acid. Make sure to drink enough water in the following days and keep your skin well hydrated with the products recommended by Dr. Giraldo. Remember that hyaluronic acid attracts and retains moisture, so staying well hydrated will enhance the results. If bruises form, you can take arnica tablets, apply Absorb K, arnica cream, or ice to reduce bruising and inflammation, and you can cover them with makeup. If at any time you notice something unusual or have any questions, you can immediately contact Dr. Giraldo. How long do the effects of hyaluronic acid last? Hyaluronic acid, unlike other procedures, has a very special characteristic. It is progressively metabolized by our body naturally. This means that the results, although not permanent, offer a dynamic beauty that evolves over time and allows for periodic adjustments to adapt to the natural changes of your face. In general, the effects of hyaluronic acid usually last between 6 and 18 months, depending mainly on the type of product used. High-density fillers, such as those we apply to cheekbones or chin, tend to remain longer, while those used in more dynamic areas, such as the lips, may require more frequent applications. Your lifestyle also plays a fundamental role in the duration of the results. Factors such as intense sun exposure, smoking, or a particularly accelerated metabolism can decrease the longevity of the treatment. On the contrary, a good facial care routine, daily sun protection, and adequate hydration contribute significantly to maintaining the results for a longer time. It's important that you know that the combination of anti-aging treatments is the best option to obtain excellent results in the quality of your skin and natural rejuvenation. Remember to request your appointment in advance with Dr. Vanessa Giraldo to perform your procedure. We are waiting for you, and follow us on our social media such as Instagram, Facebook, and YouTube. Thanks for watching. See you next time. Bye.